Let's focus on this doctor who was working at Wuhan Central Hospital. He noticed 7 cases that he thought looked like SARS. That's a virus that led to a global epidemic in 2003. And in December, he posted a warning about a potential outbreak in a chat group with fellow medics. Shortly afterwards, he was summoned by police and accused of making false statements and being told he'd severely disturbed the social order. He was then given this document to sign, and while most of it actually involved language from the authorities rather than from him, he was told, "We solemnly warn you, if you keep being stubborn with such impertinence and continue this illegal activity, you will be brought to justice. Is that understood?" Underneath it, Dr. Li wrote, "Yes, I do." Well, from there, in January, officials in Wuhan were insisting that only those who came into contact with infected animals could catch this virus. That wasn't true. Also, no guidance was issued to protect doctors. And then Dr. Li fell ill. But it wasn't until 10 days later, on the 20th of January, that China actually declared an emergency. By the end of January, Dr. Li posted this picture with the words, "Finally diagnosed." He had the virus. While Stephanie Hegarty from BBC World Service has been looking into more details in his case.
He's still in isolation and he's in ICU, but he's able to text and he's been able to post on social media. Definitely not out of the woods, but he's doing okay.
And have there been sanctions for him sharing his diagnosis?
Well, the strange thing is that he's clearly had the confidence to share this story towards the end of January, and that may be because though he was disciplined by the local police, the central authority in Beijing then criticized the police for that move, so that appears to have given him the confidence to then start sharing his story, which is quite strange for doctors in Wuhan or doctors involved in this crisis. We haven't seen many of them speaking out, or any that have. Their posts have been taken down or deleted. This has been up for 4 or 5 days now.
Well, I was going to ask you about that. You've written extensively about this on the BBC News website. How easy is it to communicate with this doctor or indeed any doctors in Wuhan?
It's not easy, and that's, I think Dr. Li's case is a clear example of just how well China can control the narrative of this story. And they've been doing that, as I said, by deleting posts, by going to people's houses and telling them to be quiet, as we saw with Dr. Li, and it's a very impressive control structure.
Now, you're a population specialist for the BBC World Service. I wonder to what degree the changing nature of China's population and where it lives, more in cities, less in the countryside, is impacting on how China responds to this crisis.
Well, it's probably not a coincidence that this happened just as China was undertaking the biggest human migration in our history. There's an estimate of 3 billion trips taken over the case of 40 days. This happened bang slap in the middle of that while people were celebrating Chinese New Year. And one of the really important things in terms of locking it down was stopping people from moving, stopping people from returning back after the holidays.
That's easier said than done, though, presumably.
Yeah, for sure. And it's not just travel within China on trains and planes, but in the past 10 years we've seen global number of passengers taking airplanes double, and most of that growth is happening in China.